Great. So today I have the absolute pleasure of introducing Ane Uriate to the YouTube chat that we're going to have. So today we're going to be talking about a subject that has become close to my heart, and it took me a long time to find somebody else that understood it because my dog went through occult tethered cord surgery. So I've invited Annie here today to talk about tethered cord and occult tethered cord. So Annie, would you like to introduce yourself and let everybody know who you are, please?
Of course. Yeah. Hi, everyone. First of all, thank you, Sarah, for this invitation. It's also a subject, and we will talk about also how this story came to
Yeah.
me too, and why I also feel quite passionate about. But my name is Ane Uriarte. I am a board certified European specialist in veterinary neurology. I'm a fellow of the Royal Veterinary College, and I am an EVBS and RCBS specialist in veterinary neurology. And I'm originally from Spain, but I've worked in the States, in France, in the UK, and I do lecture a little bit all over the place. I try to also do a lot of teaching, not just for vets, but also for pet owners or pet parents. So I have an Instagram that is called ane.neuro and a website that is called Neuronavet, which is also an Instagram. So if anyone is interested to see fancy cases of neurology, there's also surgery. So I'm just telling you that some you may see things that you may don't want to see. But yeah, I'm quite passionate about teaching neurology to vets. That was kind of my focus, but hopefully I can spread also to pet parents.
That's brilliant. And I will link those in the notes below as well for people so that they don't, if they forget or need to see it written out.
Thank you.
So let's dive into tethered cord and occult tethered cord. Could you describe what it actually is, please?
So tether means that is kind of stuck. So basically, the spinal cord is this nice tube that is connecting the brain with the legs, and it's going to send all the information from the toes, from the paws to the brain, and all the way back. So this spinal cord, that is a long tube, um, where it finish, is kind of attached. Well, it's attached to the bone, right? So it's this attachment is helping a little bit the movement of the spinal cord. It serves a little bit as I will say, a protection for all that movements that when we are moving our spine, when we are bending, when the dogs are jumping. So that attachment is made by the filum terminale, which is connecting the end of the spine to that bone. That filum has what we call internum, a part of it that is inside the dura, which is this big bag that surrounds the spinal cord. And then outside that bag has another attachment to the bone, which is the filum terminale externum. So when those attachments are whether too loose or too tight, that is going to create certain clinical signs that we will talk in a second. And tether cord is when we have that filum that is abnormal. We call it tether cord when it's an obvious thing, whether it's a malformation, an inflammation, a fracture, something happening there. And occult tether cord when we see the clinical signs, but we don't obviously see objective changes into that filum.
Okay, so this is a little bit going into my next question, which is how do we get it diagnosed? Because it's quite a complex thing to actually get a diagnosis, isn't it? And as we had with Sparkles, which we can talk about in a moment, hers was occult tethered cord, so it wasn't shown on scans beforehand, and we had to sort of piece together her case. So how would you actually diagnose a case that had tether cord and occult tether cord?
So when we have a tether cord, so the one that we can objectively see, there are some easy situations. For example, we have dogs that they have a malformation there. Screw-tail dogs, for example, English Bulldog, Manx cats, are predisposed to have something that is called spina bifida. So they will have a vertebra that hasn't completely finished. So in the development, because the vertebra hasn't finished, there is some connection between the end of the spinal cord to actually to the skin. And these animals may have this skin dimple on top. And when you do even an X-ray, and of course we would prefer to do an MRI, you will see changes there. So you have objective bony changes that tell you there is a malformation there. Those are easy. Once you suspect that there is some abnormalities on your dog, for example, a screw tail, a dimple, and the clinical signs that we will talk, urinary incontinence, fecal incontinence, lumbar pain, or walking in a little bit of a funny way, then we need to take a look of what is happening to the bone, but also to the soft tissue that is inside, which is the spinal cord. So that's when we recommend to do an MRI, much better than just an X-ray. An MRI will be like looking on 3D at the soft tissue. It's even more powerful than a CT scan. The CT scan is like an X-ray on 3D. The MRI will really look to those nerves and end of the spinal cord. So if you have normal tether cord on the MRI, you could see at end of the spinal cord that is abnormal, whether it's very short, whether it's very long, whether it has a lot of fat around there, whether it's very thickened, or it has some changes into the bone. So that is, I will say, relatively easy to diagnose. You have a dog that has incontinence, lumbar pain, and abnormalities walking, and you see something abnormal at the end, that's it. It is a tether cord. Nothing to discuss in a way.
Yeah, and so the complication with occult tethered cord and this is what I had with Sparkles, nothing showed significantly on the MRI, but we had symptoms. So then you're just guided by the symptoms of the dog, I presume, and ruling out other more easier conditions. Is that right?
Exactly, because typically the clinical signs are related, the clinical presentation may be related to the localization, where the problem is. But then the clinical history, the context, relate to the disease. And that's why I tend to spend a lot of time on my context, because the history, how things have started and how they have progressed and they have responded to medication is going to help me giving my differential diagnosis. If I have an animal with a tumor in the lumbar area or even with a disc in the lumbar area, it could also present with pain, with urinary and fecal incontinence, and with some funny walking. So that just related to, again, that area is not normal. But then when I put it together to saying, we have a dog that is being showing these signs, he was really, really young. And then we will talk that specifically for tether cord, we have a certain clinical signs that they are a little bit different when we have a sleep disc, which is going to be more acute, sometimes asymmetric, respond relatively well to pain medication, and you have a very active dog that suddenly doesn't want to jump, right? So the context seems a little bit different, but the presentation can be, if we just describe it, quite similar.
Okay. So obviously there's the medically managed route, which some people choose to start with, and then there's the surgical route. So can you talk us through a little bit about making that decision as to, because for me, especially as an owner, thinking that my poor little young dog had to have spinal surgery, it was a really big thing
Yeah.
for a layperson who doesn't know all of the technicality that's going on there. So I think a lot of people in my position do worry about having surgery on their dog. But could you talk through the how or when it would be appropriate to medically manage, when it might be appropriate more so for surgery?
Yeah. Yeah, and I think that you should be worried because it is a spinal surgery, it's a big surgery, and I personally, although I am a quite experienced surgeon, I'm not worried about doing the technique, but lumbar cases are the cases that they are more challenging for me to decide if surgery is the right thing. Why? Because, as I said, the clinical presentation can be similar in different pathologies, and the diagnostic findings, the MRI findings, are not so evident. So many times I may be in a situations that I say, I do believe that your dog has lumbar pain, 100%, there's no doubt. Let's start with medical treatment with pain relief, and there is an improvement, great. But if there is a relapse, we need to do something else, because the goal of a medical treatment is to have a dog free of pain, free of medication, and neurologically normal. That is the goal of my medical treatment. And if I haven't achieved that, I want to do something to achieve that.
Yeah.
So that's, in my opinion, where surgery comes in. So once we haven't achieved that success, dog free of pain, free of medication, and neurologically normal, then we know that we can risk a little bit more. And I don't mean risk that is a risky surgery. I mean that we are doing a surgery that we don't know if it's going to be successful. So that is a little bit my concern with this, not just occult tether core, particularly for occult tether core, but sometimes even with some like lumbosacral instabilities, because many dogs have changes on the LS area, and you obviously know because you train with jumping dogs, so you know how frequent it is to have lumbosacral pain. So my approach will always be, we always want to avoid a surgery, so we always first of all want to try to have a dog free of pain, with medication that proves indeed my dog at least is responding to pain relief. It means that he's in pain. And then if I can actually make a dog free of pain most of the time without medication, then probably I will not advise surgery. If I have a dog that is still in pain despite medical treatment, that's when we need to start the conversation about if we need to think about surgery, or if every time that we remove the medication, the animal is still in severe pain.
Yeah. And is there a point where it progresses? Is it a progressive disease, or would it occur and then
Yeah,
be the same?
yeah. So if we look a little bit at the literature, in human literature, it's true that they usually say that the mean age for diagnosis occult tether core is going to be 16 years, 10, 16 years for kids, but it can go up to 20. Some patients that they are 25 before they are diagnosed. In dogs, we don't have that many cases, but it's true the little cases they are in the literature, they didn't seem to have a big difference when we treat them later than younger. But the volume of cases that we have, the sample, the population is way too small. It's true that if we use our common sense, we'll think that if a brain has been receiving pain for many years, it's going to take longer to reset. And if a tissue has been stretched for so many years, it may not respond that well. That is our common sense saying. And I think that, yes, I will use that common sense, but we don't have evidence yet that waiting too long is bad, or that if we do a surgery when an animal is much older, it's not going to work. But what we know, and I also think that it makes sense, when we have animal with severe urinary dysfunction, which mainly we will also talk about because sometimes can be very subtle, especially the fecal incontinence or fecal, let's say, abnormal elimination behaviors, because people, when they hear incontinence, they think that is something dramatic. But if we have a dog that is truly urinary incontinent with a lot of chronic urinary infections for a long time, I can understand that that bladder, that muscle that is the bladder, may get a little bit floppy because it's always a little bit full, because cannot really this like empty completely. So if I do a surgery 5, 6 years later, I don't know if that muscle is going to be able to go back to how it was. But
Yeah.
that again is common sense. We don't have evidence. So I will not discourage someone to do surgery in their dog because they are certain age. But if they are hesitating, yes, I will prefer to do sooner than later, indeed.
Yeah, sure. So this is going to be a bit of a vague question in that why is it, do you think, that it is not that well known a condition? Is it maybe because it's difficult to diagnose, or is it because actually we don't know enough about it yet? Um, is can you, am I making sense on that question?
Yeah, I don't know. Maybe I'm going to be a little bit politically incorrect. Um, I think that of course, there is a part that the fact that is a rare disease, and even in neurology. So Dr. Kling was telling me how many cases, how many kids will go to her consultation, 12, 10 years old, and they've been going from neurologist to neurologist and no one even thought about it. So if that happened in humans, of course it's going to happen in veterinary medicine. So there is part of that is obscure, difficult to diagnose disease, 100%. But I need to admit that someone told me recently that vets, we have a big ego. And I'm sure that in general, neurosurgeons, we are known to have a big ego, particularly neurosurgeons. So I do think that there may be also a little bit of that, because I find that that's what happened with my first paper. And I kind of feels a little bit like, okay, we are 5 years late. Like I tried to talk about this 5 years ago, and I could not publish my paper in any veterinary journal because they will not accept the paper.
Yeah.
I need to publish in a human paper, human journal. So I do think that there's also a little bit of like, oh, okay, who you are, or do I want to believe, or what you like. Certain people may not have an open mind. Um, And of course, as scientists, we need to be, evidence-based medicine. We do evidence-based medicine, 100%. But when we discover new diseases, you also need to be open-minded, because you cannot not investigate a new disease if you don't accept that even exists.
Yeah. And it's going to look like it's rare if it isn't being diagnosed. Whereas actually, if everybody knew more about it,
Yeah,
then, and hence why we're here trying to raise awareness.
yeah.
Yeah. So I think that's a great point to make. Thank you for allowing me to ask that question. So yes, we have spoken a couple of times or mentioned my little dog Sparkles through our chat here. So it was my young border collie that made me found Annie. And it was actually through, I did a lot of research into the human condition because there wasn't much there from the canine side, which eventually led me to you because of that paper that you'd written, and you'd described the dog there. So Sparkles had the sacral dimple, like you were talking about. She kicked out with her back legs, even from a very, very young puppy. Um, and she had behavioral issues as a puppy. So I knew that my puppy wasn't normal, but I suspected nerve pain because of the legs kicking out. Um, but I didn't really know where to start as to who to go to
Mm.
and at what age, because you don't want to put a young puppy who doesn't like being handled through lots of diagnosis when you don't really know where to start. So where I came with her was when she was about 18 months, I think. She started becoming incontinent and having then just really persistent UTIs, which we couldn't clear up. And she'd already been MRI'd and nothing was found on the MRI. But I was convinced that through the human things that I've read,
Mm.
that she had it, which then when I read your paper and you suggested or you mentioned all of these things, it was like me ticking off a little list of this person understands all of these things that I've been asking about. So you were actually the eighth vet that I brought her to. Um, yeah, so would you like to share a little bit about how you dealt with her and her case?
Yeah, no, and thank you for coming, and thank you also for talking about it, because now we are seeing quite a lot of cases, and yeah, it seems that suddenly 5 years later, finally, everyone is kind of starting to recognize and talking about it, because I have quite a few vets that they've been contacting me in the past, suspecting that they have a dog that they may have tether core. But that wasn't as useful as all the cases that I've been having since you did the blog, because I'm speaking with the parents, because how we get that context, how we ask those questions and we listen to those little details are extremely useful. And I think that probably if you don't know about the disease, you're gonna miss those. So yeah, so when she came, for me the striking thing was, and I've observed that this in other tether core that I've seen, is how good she was in the consultation, how well behaved, how socialized she was, how easy to be around, and you telling me how difficult she was.
Yeah. So, as an 8-week-old puppy, she was on a lead in the house for defensive handling. She was so angry. She would run at you, she would bite you, she would hang on.
Mm.
She really meant it. So, yeah, we had worked really hard on handling her. And I was really proud of her, but I know that I warn everybody just to be cautious because of, how long it had taken us to get her to be social. So for me to hear you say that she was a good little dog and she was, social, yeah, it still hits me because she wasn't as a youngster. Yeah.
Yeah, yeah, no, exactly. And to me, that is one of the most striking things because it is um, when I hear a parent saying, "Oh, kind of my dog is a little bit aggressive or is a little difficult to handle." And I mean, I have very little experience with behavior. I'm not a behavior specialist, but just my experience that I see in my everyday consultation, I see it in the room. I
Yeah.
see a dog that is defensive, that is scared, that doesn't want to get approached. You have a defensive body position, um, and all these cases that I've seen is the opposite. You have a completely relaxed puppy, super friendly, that comes to you, that wants to engage, that wants to be around, but then you are reporting impossible, very difficult to train, and very aggressive and very mouthy,
Yeah.
which doesn't make sense. And that to me, again, I'm not a behavior specialist, but to me, those two don't fit to have a behavioral problem,
Yeah.
only a behavioral problem. And it just, for me, it completely sounds like we have a problem because we are in pain.
Yeah. And we'd worked through, a lot before her operation. The difference in her since the operation is there are things which now I never thought that the operation would have affected. So before we couldn't touch her front legs. We could towel dry her back legs, but not her front legs. Now you can towel dry her front legs. She recently got a prickle in her paw. She let me, fully investigate all of her toes, put some ointment on there.
Mhm.
There's absolutely no way beforehand that I could have done that without being bitten. She's now decided she wants to be a lap dog. She literally climbs on my lap. She's a bit too big to be a lap dog, but it's lovely because she's happy to be touched. Whereas
Mm.
before she'd been taught to be touched, and there was a real difference. Whereas now she chooses. So that was something which I wasn't necessarily expecting. So that's,
Yeah, yeah, no, it is very sad. It's very sad. And I think that I've learned a lot through the cases that I've seen through you, because a lot of the cases that they come through you, they come through um, working dogs or agility dogs or obedience dog. So I am also seeing that, which I haven't, like the other cases that I had before, they were not trained or obedience dogs. So some of the parents, they didn't. So they just have a dog that, oh my God, it's just like, yeah, it's just a puppy. It's just, he's not easy. He's a little bit aggressive, but they haven't worked that side. So you couldn't really make that difference that you guys are describing, which I think that is so interesting because that helps me with this, with the more questions, things that I have observed, but now I can build up my questions differently.
yeah,
Um, because I always like to ask questions that they are not whether to direct questions, they are direct questions, but actually sometimes they are hidden questions.
yeah,
Um, so by the way that I hear, I have an answer that gives me all that information. So that's for me the thing that struck me the most first from her. It's true that we were discussing when we were seeing her, we know that with Tethered cord, we kind of have the triad of having some kind of urinary or fecal incontinence, having pain, and having some problems in the back, whether lameness, whether some difficulties there. And the part that at the beginning we were a little bit hesitating with the sparkles was kind of the urinary fecal incontinence, but we knew that having these chronic UTIs um, could be because that bladder wasn't completely able to empty. So having those three together in a young dog, that's where it was kind of thinking, okay, this makes sense. She also had already a lot of investigations, and that helps me a lot. I also need to say, yeah, I was the number 8, but if I would have been the number 1, it would have also took me and a dynamic MRI and a trial with medication and time to understand if all these clinical signs were related to occult tether core or something else, because I would have had a normal MRI. So that process, unfortunately, it needs to happen. So that's, yeah, that to me the it's kind of a little bit open a different line of questioning having sparkles because of her training and obedience background,
Yeah.
definitely.
And I find it really interesting, the whole toileting sort of side of it. It's there's lots of things that I thought that were normal for Sparkles.
Mm,
So she would, I always described her as having a big tank or a big bladder. She didn't need to go to the toilet that often.
yeah, 100%.
Now I know actually it was because it was uncomfortable because
Mm,
her toileting habits have changed now
yeah,
post-op. So
yeah,
actually what she was doing was she was hanging on to it
yeah,
and only going
100%.
when she really needed to. I thought that there were times when she looked uncomfortable and couldn't get into the position to go to
Mm,
the toilet. Um, but I thought the rest of the time her position was normal for her. But I'll never forget when I brought her home and it was a 5 hour journey home. And she was 1 day post-op. Her posture was already different to go
mm,
for a wee. And you're expecting her at that stage to be painful from the operation, and yet already she could actually urinate more easily. I'd also worked with nutritionists with her because she'd always had a bit of a dodgy gut. Um,
yeah,
and it was always linked with her behavior, her
yeah,
gut.
yeah,
Um, since the operation, and again, this was something else I didn't see coming, her gut is so much healthier, and she's actually not on any supplements for her gut now. And she seems to have much more normal poo.
yeah.
Whereas I actually felt that we got her to a good stage before the op. So it just goes to show that sometimes we're missing things by thinking it's the dog.
100%. Yeah, no, and these elimination behavior changes, they are so interesting. I think that the cases that I've been having, they are all different, but it's the same. So the gut changes, I think that probably that made me also think a little bit more because I had a recent case that was quite dramatic, but it was always related to having an episode of being a little bit more painful. And I it got me thinking, could it be also all linked to this mast cell activation that we think that it can happen in EDS? So there's really a lot of places that we could start shooting around. But what I can see consistently is abnormal positioning. So a lot of dogs report to be trying to poop on a with the bum elevated,
Yeah.
whether or the legs really straight, or the bum on top of something, or a praying position. Uh, but or actually having a poop that it has a normal abnormal shape every time, like screw. There's a dog that it has like a screw poop every time. Uh, but we need to ask that question because, as you said, um, you may have a dog that has always done that and has always done only for 1 week, having a little bit that kind of neurogenic bladder to hold it also. So we need to be asking a lot of questions specifically about the positioning of the urination, positioning of defecation, and also the quantity, how many times, and the shape, and yeah, of both the urine and the feces.
Yeah, and it's really difficult, isn't it? And especially, I'm lucky I have a larger sample. I've got multiple dogs. Um, but if you've only got one dog and you haven't got a dog to compare all of that with,
Yeah,
it can so easily be missed and assumed that that is normal for your dog. And like I say, even I looked so closely at everything that Sparkles did, but I'm still seeing changes post-op that actually now show that pre-op weren't normal for
yeah.
for her. So yeah, it's not as black and white as it as
Yeah, and to for me also has been extremely helpful to work with you that you have had border collies and trained border collies forever. Um, and the same with other cases that I had with people that are behavior specialists or they are working that is particular breed for a long time because they have something to compare. Because otherwise, even someone that have dogs all their life, how will they know? How
yeah,
will they know? Impossible. It's impossible to know. And how will they be able to describe to their vet what is wrong with their dog? Because what they see is a dog that is impossible to train, that is all the time biting at you and is just overreacting, but is jumping fine. Is yeah, is peeing, is pooing. Like it's extremely difficult,
yeah,
very difficult.
yeah. And Sparkles was probably she's one of the brightest dogs that I've ever owned. One of the most talented. But behaviorally, she was quite frankly a nightmare to live with. But to describe her to people, people would go, "Oh, well, she's a puppy. Puppies bite." But it was
Mm,
so much more than puppy biting. There was a real aggression behind it. Um, but the things that I was talking to vets about and asking questions about, because I also worked for 20 years as an animal chiropractor. So I had a little bit more sort of interest in the structure and her body. But the sacral dimple, nobody
mhm,
seemed to know what it was or any implication of it. And the kicking of the back legs, it was so random. I have never managed to get it on film,
mm.
which is a shame because it was so odd. And again, I spoke to so many people and said, "Have you ever seen this before?" Everybody was saying no. And then randomly, I saw a post on Facebook and somebody mentioned tethered cord. And I actually contacted them and I said, my dog does this kicking of her legs. She says, "Yeah, I know exactly what that is. Mine did that." And I'm like, "Oh my gosh, you're the first person
Yeah,
who
yeah, yeah.
has said that."
Yeah, no, it's not something actually uh, that I particularly was aware of and I was particularly looking for. And I again, it's been very interesting to have that because as we said in humans, with all that three definition, it is a questionnaire. You ask questions to the patient, which we cannot ask. And it was actually when I present this talk many years ago at the Human Congress, and I was talking about this dog with occult tether core, and obviously all the presentations were about EDS and humans, and they do all these uh, uh, studies in humans. When you go into the toilet, they put some electrodes and see how your bladder is emptying and how you open your sphincters. So they evaluate, the strength. So and you will read that a lot of the papers for humans, whether when we remove the tether, they always use electrophysiology a lot. For us, it's difficult, it's very expensive, we cannot do it. And I was a little bit kind of laughing that after the surgery, the dog, he could urinate normally. I could put a video of him urinating. So I said, okay, I cannot do the electrodiagnostic test, but at least I can put you the video of a dog urinating without getting sued. And exactly the position, it was a completely different before and after surgery, how he was. But it's true that the kicking is something that I haven't particularly pay attention to the kicking. I thought that it was more like a response to the pain, uh, but probably is more related to some kind of maybe ortho changes. Like in humans, they have also flat feet. They will have flat feet. Like yeah, I don't know what it is yet, but I don't think that it's just. It may not be just pain. Mm,
Yeah, it's interesting because, and again, I will put this link in the notes below. There's a group on Facebook for dogs with tethered cord, and a lot of the dogs in there kick with their
yeah,
legs. So it's interesting when people come on and say, my dog does this thing. Has anybody else's, or is this my dog, or is this related?
Yeah,
And
yeah,
quite often it's with these little weird things that everybody
yeah,
goes, oh yeah, mine did that. Um, and building that whole picture can be quite complex, can't it? So yeah,
yeah,
yeah.
yeah.
So is there anything else that we haven't talked about that if somebody's listening to this and they are suspecting this with their dog that you would like to share with them?
Um, I think that I mean, we are doing this to obviously raise awareness, and I am very happy that finally we're talking about this disease. But we also need to be a little bit cautious that rare things are rare. So we don't want to go the opposite
Yeah,
way and thinking that every single dog that has lumbar pain, urinating in an abnormal position is going to have tether core. But it's good that we are knowing about it and we think about it. But we're going to need to go through the process, and it's going to be frustrating because you're probably going to need to speak with a couple of vets, and you're going to need to see an specialist because your first opinion vet is not going to be able to diagnose this disease. And probably we're going to need to go through imaging and trial medication. So it's going to be a process. But um, we're going to want to try to avoid your dog having surgery. But if your dog has surgery, we're going to need to try medical treatment for a little bit. So it's going to be frustrated. We're going to need to be patient, and we're going to need to calm down. We don't want to start doing surgery in every single dog that is 8 months old. So we have a little bit of time to, it's painful to see our dog in pain.
yeah,
Um, and we need to try to find the best medication possible so they have the best life. But we also need to gather information so uh, we made the right decision when we are doing surgery. Yeah,
yeah. And I would highly recommend people keep a diary of their dog, take photographs, videos of
videos.
anything
Yeah,
that you think is suspicious, because then that can also help you, can't it, in the diagnosis. Yeah.
yeah.
Well, thank you so very much for sharing your
Thank you,
knowledge
Sarah.
today. I really appreciate you. Do you just want to tell people again where they can find you? And I will also write them in the notes underneath.
Yeah, I think that what we were saying a little bit, because of I've moved in a little bit different countries. I think that the best thing, if people would like to have a consultation with me, we have left a link where I will be able to evaluate the imaging that they have done, and obviously get into contact with their vet, with their neurologist, and we could do a consultation, discuss about the case, and then obviously see if it will be a surgery candidate or not, or if we need to review the medical treatment. So yeah, I think that this way with my website will be a way to hopefully be able to speak and contact everyone regardless of where I'm working.
Fantastic. Thank you so very much.
Thank you so much.
Really appreciate your time and the fact that you're getting the message out there to vets and us owners as well.
Yeah, thank you very much, Sarah. Thank you, everyone.